we go. Yeah. A little video, as you know, of what we do here. Gotta lift this up so that we can get to it.
And what are you taking out now?
There's a blackhead right here.
Really?
Yeah. Those are some of our favorite things to remove, or people enjoy us removing them, that is. Sometimes it's hard to grab your little neck here.
I got lots of wrinkles to grab.
No, you don't. Grab that one off, and then there's this one right here that I haven't, it's still attached to me. I didn't nick it, so maybe. Look at that. Just put one little nick here. I already numbed the area. Okay. Comedone extractor in this case. Just a little pressure pushing on you. Make sure we get all that out. Let me just push it one more time here just to see if that does something. Usually that will just shell out anyway. Good. All gone. Let's get close up. There we go. So we have a little Farver Rocochot here, which is from Sun. I'm just making a little nick in your skin. Sorry if it's a little pinch. Just some of these, just try to see if we can't expose them a little bit. And a little pressure on some of them. You okay?
Yep.
Okay, good. Do that one again. The first one came out so nice and teased us. Sometimes because they haven't really been softened up with a little retin-A, they're a little, or retinol, they're a little harder to squeeze out. But we'll get the hang of it here.
It's kind of like my nose, I guess. I don't know.
Yeah, well, your nose has a little bit of thickening on it. It's not as easy to, I mean, I bet you if you squeeze it, right, a lot of oil kind of comes out, which is normal because
Well, not really, but
oh, okay.
it gets redder than hell, though.
I'm sorry?
I say it gets redder than hell.
Yeah. I mean, you have a little bit of rhinophyma, which is a little bit of thickening of the skin there. But that is something more of a surgical kind of procedure to do that, where we have to numb that area and really kind of, it's almost like we use a little loop device that is almost like a hot knife through butter, you know?
I've seen you do that on TV.
Yeah, so it's not, I mean, we make sure you're nice and numb so you're comfortable, but, you know, there's a little bit more downtime and things like that. How many hole-in-ones did you say you have?
2 so far.
Oh, you're gonna beat me for sure.
And 3 just misses.
Just misses. I had one time that I think I actually called it out. Like, what if I got one? Like, I made a big bet with my husband, and I actually bounced right over, like a small little skip right over the hole. And let me tell you, I wish I had a camera to show my husband's face. He was gonna have a heart attack. So these are called Farver Rocochot, actually. They're solar comedones. They're like blackheads and whiteheads that occur from sun exposure. That's why they occur on the sides of our eyes. I
get a lot of sun exposure.
Yeah, there's a specific name for them.
What was it?
Farver, like Brett Favre.
Yeah.
Farver Rocochot. It must be named after two
Huh.
popaholics. two people that, two dermatologists, I'm gonna guess. So we'll get this cleaned up a lot because you're so nice and patient with me. I appreciate that. There's a lot of little smaller ones, but hopefully this will help to clear up most of them. And then if they start coming back again, because I don't think you're gonna change your lifestyle too much. You lead a pretty good
Too late
lifestyle,
for that.
yeah.
I'm pushing 74. I don't know why I'd want to.
You look pretty good. Hey, we're a good team here, right? That's pretty good. So I just put a little nick in the skin in a lot of these areas, so they might do a tiny little, slow little ooze, and I bet you some of this will still continue to come out, like when you wash your face and things. So it should continue to kind of clear up.
It suits me fine.
Better, okay.
It's not painful.
Okay, yeah, you can feel me touching you.
Yeah,
You shouldn't feel
right.
anything sharp, good, because I can see it up there.
Oh, look at that. Oh, gross. Nice.
It's kind of cute,
Look at that.
isn't he?
Oh, look at that.
Yeah, that, wow.
There you
Nice.
go. And so it's like a dilated pore. That can heal
Yeah,
up,
that's
but
what
sometimes,
my doctor had told me.
sometimes it'll fill back up again to give somebody another joy, some more joy.
Oh, it
There
did
you go.
come back once, I
This
think.
is your
But yeah.
uncut gem.
Put it on a
gem.
ring, right?
Yes. Oh, it's actually bigger than it looks. Well, that was cute. Getting closer a little bit sometimes. Thank you. This would be very hard for you to do yourself because you got to look through your eyes to be able to see it. And also, it's a very sensitive area, so it's nice if we.
It's in
Might
an
give you a little
awkward
bit.
spot when you wear glasses.
Yeah. And with you, do you need your glasses to see up close?
No.
So it also makes it hard because well, I don't know. I feel like sometimes, well, actually, maybe it's harder if
Well,
you have to use them to see up close because
I
then you
see
can't
what you're
wear them.
saying, yeah.
I think the rest of this will actually work its way out when you just drag your little nail across it
Okay.
because it's open. It's almost all out, but I think there's a little bit. I don't want to just go. I don't want to bruise you too much here because I feel like now that there's a little opening there, it'll work its way out. See if I can get that delicate rest of it. Come on this way. Here we go. Hold on, let me just put this down. That's a little bit collected. There we go. Good. Just a little pinch, right? It's not too bad.
No,
I don't even have to put numbing there. I don't even have to nick them. They seem to come out very easily. Just gonna work all on the see. Look at all these that just pop up all around. You don't even see them. They're like hidden. Look at that one. Oh, you're gonna need some popcorn today. Get some popcorn and go home and watch these. I feel like there's still something there, but I might need to nick that. Let's go move a little bit. I could just concentrate on one area here. You had oily skin when you were a kid, huh? You had acne? Yeah. And you had it on your back too?
I did.
Yeah, that's what kind of causes these little pockets, you know, like scars kind of create these little things here. I don't even think you're oozing up there, right? You're okay? I don't think you have to hold that there. You're doing okay here too, right?
I'm doing fine.
I actually think that your video was one of the early ones where it actually changed the look of it. Like your skin looked more damage than it is. So I'm glad that I can show you the way you really are this time, because it actually, when I first started editing these videos, I didn't know that it was color correcting for me, but it was color correcting it incorrectly. So this one I'm gonna put true to color. Gosh, it just clusters right here in the center where you probably couldn't reach when you were a kid. How old were you when you had bad acne? What age was that?
I'll probably say around 12, 13.
Really? Yeah, it's a pretty young
14.
age to have it. It's tough too when you have that when you're a kid, huh? You just feel kind of self-conscious.
Yeah, you do. Mm-hmm.
I think if a lot of youngsters, it can shape their personality really when they're kids, because you know, you might make you more of a recluse or quiet, you know, but you came out of your shell all right. I think they're mainly clustered in the center here. These are all better. They're all like more in our mid back there. I saw some up here. You can lift your head just a little bit right here on the side. These neck ones here, there'll be a pinch here maybe. Right here. Isn't this funny? I know when I first did a little biopsy on you,
Oh my gosh, I had a heart attack.
this is
I had a
fine.
heart attack, didn't
Yeah,
I?
you trust me. Let's see. Okay, here's some on the shoulder. All right, good. Let's wave on right here, and then I think we're almost done. Yeah, it's not too bad. Not too bad, but you're still what we call a gold mine here.
Yeah.
I'm gonna shift you a little bit more, shift a little more. There we go. This side is maybe better up here, this one. More. A little bit, maybe. I think I got some of these, but I think I gotta come back sometimes and they give in.
They give in.
Yeah, sometimes they don't really give you anything the first time, and then it's like they get distracted. I feel like, you know, I feel like they're like, oh, she missed me. I'm gonna just hang out here, and then I come back and I get them. That's how crazy it's become. I think these are okay. Some of them are just little ones. I feel like their majority are right here in the center, and that if I just push around here, I'm gonna like hit more of them. No, I think we're pretty good. Let's just check. I feel like I haven't done this side too much. Yep. We got the really big ones last time, so most of these, there's something right there. Looks pretty good. Well, I think we're pretty good. Let me get a couple more down here just to push against your lower back here that are hiding from me. These are like more like your standard run-of-the-mill ones that we got here, but you're a good producer. Not done popping? Check out this next video or check out my all access membership page to watch more videos.